Thank you. The FDA has approved 2 treatments for sickle cell disease. They're revolutionary because they're made possible through what's called gene editing. Sickle cell affects about 100,000 people in our country, most common in African Americans. It can be terribly painful and possibly lead to permanent damage or even death. As Dr. John LaPook shows us, gene editing is a drastic step, but it may also bring drastic improvement.
From the time he was a baby, pain was at the center of Johnny Lubin's daily existence.
Like my lower back, and it'd really be hurting.
Johnny had inherited a gene for sickle cell from each of his parents, Fabienne and JR.
It was devastating as I found out and discovered more about the disease.
Pain from sickle cell can occur anywhere blood circulates. That's because red blood cells, normally donut-shaped, bend into inflexible sickle shapes, causing them to pile up inside blood vessels and prevent the normal delivery of oxygen throughout the body. Complications include bone deterioration, strokes, and organ failure. For more than a decade, Johnny was in and out of the hospital.
We felt like he suffered for so long and so much that we wanted to try, anything.
In the past, that would have meant correcting those abnormal red blood cells using donated bone marrow. As an only child, Johnny had only about a 15% chance of finding a match. But then, the family learned about a cutting-edge clinical trial to edit a small number of the billions of letters in Johnny's genetic code and relieve his symptoms. No donor would be needed.
They did explain that it's a trial.
First, stem cells were removed from Johnny's bone marrow, and he was given chemotherapy to help wipe out the abnormal cells. Then, in a laboratory, the gene editing technology called CRISPR was used to increase the amount of a protective form of hemoglobin, a protein that picks up oxygen from our lungs and delivers it throughout the body. The cells were then infused back into Johnny's bloodstream. Dr. Monica Bhatia is chief of pediatric stem cell transplantation at New York Presbyterian Columbia and Johnny's doctor.
You're reprogramming your cells to produce fetal hemoglobin. And it's been widely known those who have higher levels of fetal hemoglobin tend to have less severe symptoms of sickle cell disease.
As an investigator in the CRISPR trials, Dr. Bhatia was well aware there was no margin for error.
You're changing somebody's DNA, so obviously you want to make sure that the corrections you're making are the ones you want.
October 4th was infusion day. We like to call that my second birthday.
After 5 weeks in the hospital and 6 months out of school, Johnny was living a whole new life.
I thought that was pretty cool, how I have new cells. And I honestly hoped, I could get, some superpowers from it, like genetically engineered.
His doctor said everything looks good. He can go and live his life as a normal kid.
Dr. John LaPook, CBS News, New York.
Amazing stuff. Now, the doctor also mentioned some unanswered questions about these treatments. First, how long will the effects last? It takes years of watching to see if it turns out to be a real cure. There's also a huge price tag that needs to be mentioned, several $1 million per patient, and it remains to be seen how easy it'll be to get those procedures covered by insurance.